Okay, I think we're ready to start if everyone would like to take their seats. Well, I want to welcome all of you to this panel on public health and the people's vaccine. For those of you who don't know me, I'm Susan Elliott, and I'm from the US. I'm the president of the National Committee on American Foreign Policy, and I just would like to congratulate the Nizavi Ganjavi International Center for holding such a fantastic conference, the forum, and my organization in New York is very pleased to have long-standing cooperation with Nizavi Ganjavi. So it's my honor to be able to moderate today's panel, which is on a very timely and important topic. Everyone knows that COVID-19 has really accentuated the weaknesses and inequalities of the global public health system. And I think this discussion, especially today, following the discussions yesterday, is very appropriate because we heard from almost every speaker yesterday about their concerns about inequitable distribution of the COVID-19 vaccines. Just to give you a few statistics, it's reported that 50 middle and low-income countries globally receive less than 10% of their populations have received at least one dose of the virus. And the continent of Africa has extremely been hard hit, where only about a little more than 5% of the population have received any dose of the vaccine. On the other hand, G7 countries have purchased more than 1/3 of the world's vaccines, and they have about 13% of the world's populations. So I'm very pleased that we have reliable vaccines, and we have a mechanism that's been developed to distribute them. The COVAX distribution, as well as access to COVID tools, which is called the ACT Accelerator. These are ways that we have put together, the World Health Organization and the global community, to be able to try to ensure equitable distribution of the vaccines. And just to tell you a little bit, if you're not familiar, the ACT Accelerator is a global collaboration, and it's mainly to look for ways to accelerate the production and equal access to the COVID vaccine around the world. And in fact, the leaders of the ACT in WHO have encouraged the heads of the G20 to just briefly to increase supplies of the vaccine to the world's poorest, as well as ensure vaccine access to all peoples of the world, and to be able to have the richer countries help in the distribution and donation of the vaccines. There are countries that produce the vaccines, like the US, my country, the United Kingdom, the countries of the EU, China and Russia and India, and they have begun to help in the donation and distribution, but I think we need to do more. According to UN data, the top donators of vaccines to COVAX are the United States, China, Japan, India, the United Kingdom, France, Canada, Spain, Sweden, and Poland. So today we've assembled a great panel of experts to discuss how can we ensure that there isn't a trend that we can make sure that the poorest people in the world get access to the vaccines in the same way the people of the more developed countries had. And how will we be able to encourage countries like my own to make sure that we donate and then help distribute and share the vaccines? I think we still, as you see from the statistics, have a long way to go, but that's why I'm very pleased today that we're going to discuss ways that we can help in the distribution, and perhaps look for ways that the vaccines can be manufactured in countries that now are not looking or do not have the ability to distribute the vaccine. And I know this has been a discussion in the US, and that people in business and former government officials have encouraged the Biden administration to look for ways that we can protect intellectual property rights, but allow for the manufacturing of vaccines in places that are underserved around the world. So I want to first get started with our first speaker, who is Dalia Itzhak, who's the former president of Israel. And we know that Israel had been very successful in their vaccine distribution. And so I will turn it over to her.
Good morning, all of you. Thank you for the invitation to say a few words on this important and timely issue of public health, together with these distinguished panel members. I will introduce myself. My name is Dalia Itzhak, former minister and member of parliament in Israel, and I served in ministerial positions, and I was speaker of the parliament. But the following a long political career, I recently became a chair of the Hadassah Hospital organization, which considered the Harvard of the Middle East. Hadassah is a world-renowned hospital based in Jerusalem, one of the biggest in Israel, and definitely one of the best even in international standards. Only recently, the oncological and cardio services at Hadassah were ranked among the best in the world, according to the Newsweek magazine. Hadassah treats the entire Israeli population, especially in Jerusalem area, Jews, Arabs, Christians, secular, ultra-Orthodox, etc. I will be speaking, in your permission, both as a former politician, aware of the challenges of policy making, and as a chair of medical organization dealing with the pandemic on a daily basis. But first, a few words on a personal note. In first few months of the pandemic, my son, together with his wife and 3 children, were found positive for the coronavirus. The first reaction was fear, especially since very little was known on the virus at that time, and since they lived in New York, while the rest of the family was in Israel. Thankfully, the children and my daughter-in-law only experienced flu-like symptoms and general weaknesses, but my son reports he has not fully recovered until now, a year and a half later. This is a very tricky disease, and I can tell you from his experience that it has its effects long after the symptoms are gone. And this is, of course, only the tip of the iceberg, not mentioning cases where it further complicated existing conditions or has fatal consequences. This personal experience and many others can be now avoided thanks to the vaccines, and we in Israel were fortunate enough to be the first country to vaccinate the large part of the population. Today in Israel, out of slightly more than 9 million citizens, over 6 million have vaccinated once, over 5.5 million have been vaccinated twice, and almost 4 million have received the 3rd booster vaccine, including me. Recently, the vaccine for children under the age of 12 has been approved, although it might be difficult to persuade these parents to get the children vaccinated. I took the liberty to collect some data from our teams at Odessa, and thankfully, the majority of the population over 60 years old in Israel is vaccinated. However, as the age decreases, so do the vaccination rates. We face a difficulty to vaccine the youth who are quickly influenced by conspiracy theories and fake news. Conspirators and fake news spreaders endanger us all. It seems there is no way to win this battle. Only personal experience will convince anti-vaccine supporters to protect themselves, and even close circles experience does not always help. Personally, I can tell you that I live close to our health minister, and I witness protest on a daily basis. Israel, of course, not the only country where such protests occur, and it upsets me to see so many people risking themselves and others without looking at the facts. The pandemic has confronted all countries with a real dilemma. From a public policy perspective, while it is true we all deserve the freedom of choice, and this is especially true when it comes to health. The phrase, no one is safe until everyone is safe, as indicated in the introduction to this panel, cannot be more correct. The pandemic has taken us back to the ancient debate over the social contract and our mutual dependence as a society. It will happen if the entire population agrees to waive a piece of its freedom that everyone would be able to live freely. It is not easy to accept this in the 21st century, where individual freedoms are considered most important, especially among young people. I can attest from my experience, where I sit as the chair of Hadassah, a medical organization, the numbers speak for themselves. The variety of the population in Jerusalem, as well as the crowded neighborhoods, especially in ultra-Orthodox and Arab communities, made the spread of COVID much easier. As the consequences, Hadassah had to treat hundreds of corona patients under very difficult conditions. Today, medical teams in Hadassah report of far less patients who are vaccinated than non-vaccinated. Those who are unfortunately do get hospitalized recover much quickly and hardly need artificial assistance. Even with the new variants, the booster vaccine helps to avoid serious illness and keeps the population safe. Fortunately, one of the advantages of this Israeli medical system and what has helped in Israel getting population vaccinated quickly is medical service in the community. Every community, they have the medical service. There was no need to establish vaccination centers, but everyone could go to their community clinic and get vaccinated. The spread of clinics in the community has made vaccination more efficient and free to everyone in the so the hospital could focus on the severe cases which no require special care. Now, one point from the global perspective. We have witnessed for the past 2 years no less than international race for vaccines, where countries compete one another, while COVAX is the best interest of the global population. It also confirmed the national interests of each and every country. Countries are interested in protecting their own population first, which is understandable. But now the main concern should be promoting vaccine to all and including them as part of international agreements. I can tell from Israeli experience that we have shared vaccines with several countries as part of our foreign affairs policy, and I think this is the right thing to do. Honduras, Guatemala, Czechia, and also the Palestinian Authority. Now, governments have an important role when it comes to vaccines. There should be a clear policy and coordinated action to promote the vaccination of population. This is true in each and every country as well as globally. Media campaigns are extremely important together with meeting the people where they are, the workplace, school, leisure, etc. Sometimes people avoid vaccinations for convenience reasons. This is can solve by reaching out to them and facilitating their access to vaccine. I would like to conclude in a few words. It is also important that vaccine would not become yet another source of inequality or questions of resources. In Israel, this was avoided thanks to the community clinics, yet from a global perspective, all vaccines need to be free and accessible as much as possible. This is our responsibility as the citizens, decision makers, and leaders. Thank you.
Thank you very much, President Istak. You know, President Istak has raised a couple of issues that I didn't mention at the beginning, but they're ones we could probably have a whole other panel on. One is what I would call, she mentioned from her son, the long haul syndrome, where you have the disease, you recover, but you don't fully recover. And this seems to affect different people differently, but it's an issue for the healthcare systems around the world because it will put a strain on how do we deal with people who have long-term side effects from the COVID. I also thank you for sharing your personal story because I think that also helps for people to personalize. I've known someone who's been ill, I've known someone who died. I've had 3 friends who died from COVID. And the other thing that you raised that I think we all need to think about is even if we get a good system of equitably distributing vaccines, how do we deal with the misinformation of people not wanting the vaccines because they don't trust the healthcare system, they don't trust the, whatever reason, they don't trust the vaccine. And this is hard for me to understand, having grown up mostly in the 20th century and thinking that to me, vaccines are a medical advancement and miracle, and why would someone not want to take the vaccine? So those are issues that I think that we will need, if we can't address today, they're issues that I think we need, you know, to discuss. But I'd like now to turn the conversation to the Acting Minister of Health from Azerbaijan, Minister Timur Musayev. And as many of you, as we heard from President Aliyev yesterday, that I think Azerbaijan has had a very good strategy for dealing with the pandemic. And so we'd like to hear more from you. So Mr. Minister, the floor is yours.
Thank you. Your Excellencies, ladies and gentlemen, for me, it's a big honor to share with you this important stage nowadays. And as a medical professional, I feel special responsibility for any message delivered today from this stage. The COVID-19 pandemic continues to put much pressure on healthcare systems across the countries, and this is a big challenge for any kind of governance, state governance, local domestic governance, healthcare governance. I would like to pay your attention especially to the figures expressed by the World Health Organization regarding vaccine distribution. Look, in high-income countries, these figures is 133 doses per 100 people. In low-income countries, it's just 4 doses. Just imagine 4 doses per 100 people. With such a situation, we will not be able to control pandemic effectively and will live in a world that will constantly wait for the next waves. In this regard, I would like to share with you our Azerbaijan experience, how in my country this situation was managed effectively. Under the leadership of His Excellency President Ilham Aliyev and his proactive politics and international connections, our country used to get on time, continuously, necessary amount of vaccines, and according to national vaccination strategy adopted by the government, starting from 18th of January this year, vaccination campaign is going on very effectively, and up to now, more than 60% of target group of population got 2 jabs of the vaccine. Those who passed already 6 months exposure of the second dose switched on effectively to the booster vaccination campaign without no limits. Strong public campaigns were performed together with civil society, media, certain organizations, not only just to attract people to vaccination, but also transparently show how it's going on. All the figures delivered openly, and people could see direct relations between numbers of vaccinated, numbers of infected, numbers of accepted to hospitals, and numbers of deaths and ICU cases. This discrepancy between vaccine supply and distribution among the countries bring us to the time that we have to make very important decision. It's time for the global response. And global response means only one thing. The global pandemic policy should be worked out and accepted unconditionally by all the WHO member countries in order to predict all emergency situations in the future. It's clear that vaccination process should go in synergy with other measures like contact tracing activities, infection localization, diagnostics. I think everyone in this audience and beyond understand clearly what does mean PCR testing that proved to be the most effective method to diagnose this infection. Although it's effective enough, it still is not fully affordable in many healthcare systems worldwide. So there are big needs for express tests, self-isolation, and other measures that require certain fundings and scientific research. From its first day, when pandemic knocked our door, Azerbaijan government deployed all strategic capacities for the fight with this situation. 50 new laboratories were set up and integrated to existing network across the country. COVID beds capacity were increased up to 10,000 beds, and 46 hospitals were attracted to accept COVID patients. Also, simplified import rules were implemented, and all necessary facilities to fight COVID-19, including laboratory tests, pharmaceutical production, high-tech equipment for ICU units, and other medical amenities were immediately brought to country. As it's well known, COVID-19 waves, pandemic waves, cover countries with different paces, and it gives incredible chances for countries to exchange their experience, and I will come to this point especially. And we have very good experience in international relations with Turkish, China, Russia, Italy, and Cuba colleagues, and we immediately enhanced our human capital capacity, especially regarding ICU units, that immediately showed itself by reducing hospital stay time and death rate. It's clear that distribution of vaccines and the production should be performed through high-tech biomedical production lines, mobile one, I would say, not huge volumes, and it will help to deliver vaccines on time to all the countries. And one of the major steps should be done. It's new rules, international rules, pandemic rules, to manage intellectual property over COVID-19 vaccines. Azerbaijan was one of the first countries among those who joined COVAX initiative. And COVAX initiative is a platform, first of all, targeting saving the lives. But unfortunately, this initiative faced with tough free market rules. And this is why global community should undertake all the necessary steps and actions to support this in order to provide continuous supply of the vaccines all over the world. Only obligatory policy of the World Health Organization would prevent member states from unfair vaccine distribution. Digital technologies came to the help humanity at this time, especially in healthcare. I am far from position to discuss issues of telemedicine, how it helps in my country to deliver top-level consultancy even to remote areas among the country, and also provided international consultations with most advanced colleagues in this field. Azerbaijan, on a global level, has put forward several strategic steps and initiatives, and from the first day was against vaccine nationalism and vaccine stockpiling behavior of certain wealthy countries. This March, as a result of it, with the initiative of Azerbaijan as the chair of the non-aligned movement, the United Nations Human Rights Council unanimously adopted a resolution on equitable and universal access to vaccines. This pandemic learned us a lot, and I would like to mention few lessons I think we should remember. The first one, necessity of information sharing and networking programs. Only transparency, only opening all the data regarding pandemic can help globally to stop this situation. Proper and on time big data analysis will be incredible support for further strategic decisions. We should be embraced to change our attitude towards investing to the healthcare and don't accept it as an expenditure anymore, but as investment to resilient and sustainable economy. Each crisis is a big opportunity. Humankind made all its huge progressive jumps only through breaking crises. This crisis is the same. Crises were different in the history of humankind. It can be climate change, pandemics, wars, But since the globalization is on progress, it seems to be that only two crises will face the humanity in the future. It's crisis of pandemics and crisis of climate change. In this regard, our discussion today is a big opportunity to come to a unified platform of global approach to manage pandemics in the future. I would like to end my speech with aphorism, the great Nizami Ganjavi, that very clearly express the situation all of us live now. There are locks that have no keys, but sooner or later, the openers come. Thank you.
Mr. Minister. Actually, you've really brought up a lot of points about how important it is for government planning, and that to me, healthcare is not a commodity, but it's a human right. And you've also just pointed out that how wise the poet Nizami Ganjavi was, that that his words still resonate today. So I'm very glad to be here, and thank you for sharing. I think also your point about looking for ways that pharmaceutical companies can produce vaccines in areas like, for example, Azerbaijan, to be able to distribute in the region, I think is extremely important. So we'll go to our next speaker. Our next speaker we have digitally and should appear on the screen behind me, and it's Danilo Turk, who's the former president of Slovenia. So I think, yeah, there we are. Hello, Mr. President, and we look forward to your remarks.
Thank you very much, Madam Moderator, and let me start by saying how pleased and honored I am to be part of this panel, which is dealing with one of the most important problems of the world today. And the speakers so far have already addressed some of the critical questions that need to be discussed further, and perhaps made a matter of recommendations for the future. I would like to start by repeating what you, Madam Moderator, have already said. I mean, COVID-19 has unveiled the reality of the world. The many shortcomings, deficiencies, many problems of the world. And I think this will be an extremely important lesson for future policy making and for international cooperation. Now, one of the lessons that we have learned is that healthcare is still, and will probably be for a long time, predominantly a matter of national policies and national health systems, and that the international cooperation remains relatively weak. Now, this applies to the global reality, but also to regional situations, such as, for example, the European Union. Now, Slovenia is a member of European Union, and we have expected more effective regional action by the Union. But then, of course, the Union itself did not have any real powers in matters of public health. So the initial months were really characterized by serious problems and diversity of policy approaches in different European Union countries. Now, this will have to change, and it is starting to change. On the other hand, we understood that the African Union has been relatively successful. It's been more efficient in the initial reaction to the problem of COVID-19. But obviously, later on, when the question of vaccines became central, Africa is at a disadvantage, in a disadvantaged situation. And today, I think the international attention should be focused on the need to provide vaccines to African countries. Now, obviously, we have learned many problems in the process. Minister Timur Mesaiev, who spoke before me, mentioned the vaccine nationalism, something that has to be seen, considered seriously and critically, unfair vaccine distribution practices, and he spoke about the need for a global unified platform for dealing with future pandemics. Now, Madam Moderator, you mentioned in reaction to Minister Musayev that we have to remind ourselves that the right to a high standard of health is a matter of human rights. And this is the case. If one looks at the International Covenant on Economic, Social, and Cultural Rights, we will find in Article 12 a provision which says basically that everyone has the right to the highest attainable standard of physical and mental health. And states have to then make sure that this is achieved. Obviously, there are 171 state parties to this international treaty. And Article 12 of that treaty should be an important global platform, legal framework within which further solutions for international cooperation are sought. So I think that's important to keep in mind. We also, of course, have to understand that not all states are parties to the International Covenant on Economic, Social, and Cultural Rights. The United States is not a party. But then again, we all know, and we have followed the discussions in the United States for decades now, how important the question of health system, health coverage, and the highest available standard of health in the United States is. And of course, the United States is a rich country with large resources and excellent health facilities. Obviously, there is still work to do, I guess, like in every country, to improve. But I think that at the global level, I think the question of what is attainable globally has to be put before international institutions very seriously. What is attainable? How should the international community organize to ensure that what is attainable is actually attained? Nowadays, still, there is a lot of hope for the World Health Organization to be in the lead, and this is correct. The World Health Organization is going to have later this month an important meeting of its assembly, and we hope that that will generate some important ideas. In addition, we have seen in the past months that there was a host of international activities which I think should be brought together. There should be a kind of a comprehensive plan at the end. Let me mention just one. For the question of vaccines, a variety of civil society organizations have made requests to the G7 late spring and to the recent G20 meetings. Well, that includes the organization Club de Madrid, which I'm chairman of. The Club de Madrid is an organization of about 110 former democratically elected presidents and prime ministers. And I'm sure that a few of our members are sitting in the room. And we are kind of a sister organization of Nizami Ganjavi Center. We have, our members have both contributing their signatures to requests for more efficient and larger distribution of vaccines to the countries in need, especially in Africa. But that didn't produce much of a result so far. The meetings of G7 and G20 have generally been fairly disappointing. And although it was an assessment of experts that it would be possible to distribute about 1 billion additional doses to countries in need in the next 4 months, this is not likely to happen or may not happen. We'll see what happens, but we cannot be optimistic at this point. In addition, the problem that some doses will expire before that without being distributed to where they are needed is another problem, which is not only technical and medical, it's also an ethical problem for the international community. So I think the need to look into the question, which I think was put before us by Minister Musayev very clearly, how to create a unified global platform, what kind of organization would be necessary, is becoming critical. And let me refer to 2 ideas that are currently being discussed, and I think should be given some attention also at the present Baku Global Forum. One idea was proposed by the Panel for Pandemic Preparedness and Response, which was established by WHO earlier this year. And it has proposed creation of a new body, a special body, which would be called Global Health Threats Council, which would meet at the level of heads of state and government to deal with pandemics that are possible or that are incipient, and decide on measures to be taken quickly and with the necessary authority. So the question of a global health threats council is already there. The proposal is there, and it will be interesting to see how various international actors react to this. What do they think? The major players in the world, organizations of states, WHO, United Nations, and others. I think this requires serious attention. I'm not suggesting that the establishment of such a council would solve all the problems or anything, but it is sufficiently serious, sufficiently important, and is coming from a sufficiently experienced group of experts, not only medical experts, but policy-making experts more broadly, so that it really merits serious attention. Now, the other idea is more recent and more, how should I say, general. It comes from the realization that the current international system did not provide a sufficiently coordinated and sufficiently broad international response, and that the United Nations so far didn't play its role and has not yet used its convening power to the full. So the proposal is now emerging that the UN General Assembly should meet in a special session, perhaps late this year or early next year, and then adopt a kind of a platform, which should start as a political platform, really, on what the United Nations, what member states, what the international community sees as the way forward to a better, more integrated international system, and also to kind of a unified platform which is needed in order to prevent further infectious diseases to become threatening pandemics. Now, I'm focusing on these two proposals because I think that they merit attention and could be discussed further in the Baku Global Forum and, in other fora which are meeting this autumn. But that, of course, doesn't mean that this is the only thing that has to be given attention to. And we have heard from the previous panelists about very important aspects that have to be discussed further. And I should also add, obviously, the technological development goes ahead. It was very encouraging that the US company Merck produced already a medicine, Molnupiravir, which seems to be quite effective and was approved in the United Kingdom already last week. So that's good news. And if pills, vaccines could be made, that would be a big news and very helpful for further dealing with COVID-19. Because oral vaccines, obviously, and oral medicine is easier to distribute, requires less technical equipment for that, and is easier to administer. So I think that technical advancements are taking place, and this is good news. But of course, the main problem of international cooperation and making sure that it is understood that the right to the highest standard of physical and mental health is a human right, that still needs a lot of work to do, and our Baku Forum is one of the places where some of this work can be done. I thank you for your attention.
And I think you have raised some very important points about the importance of multilateral cooperation. And perhaps I think the thing that you mentioned about regional cooperation and how the European Union could have been better prepared on healthcare issues. And your idea of a Global Health Threat Affairs Council, I think, is extremely important, because as going back to one of the first things I said, we've seen that not just dealing with COVID, but when, even in a country as such as my own, when the healthcare system was stressed with the pandemic, it left the openings and the weaknesses to be shown. That how do you deal with then the regular health problems, people who have cancer, people who are in accidents, heart attacks, when the system is overwhelmed with COVID. So having a good plan for how to deal with this is, I think, extremely important. And as the minister said, sharing of ideas, being transparent, I think is critical for all of us to prepare for and avoid having, we know there'll be pandemics in the future, but how can we be best prepared to handle them? So we also have another digital speaker. We have former Prime Minister of Latvia, Ms. Lamdoda Strumja, and she should be on the screen. And Madam President, the floor is yours. So thank you for being with us today.
Thank you, Madam Moderator. The coronavirus has shaken lives of everyone, but without doubt, the corona saga will come to an end. We will get back to our lives, but that life will be different. It's not possible to avoid economic and social changes. But today, I want to touch 3 items: international cooperation, healthcare organization in national level, and security and veracity of the information. International cooperation. The virus is a threat everywhere. The only way to defeat a virus is to defeat it everywhere. I believe that there is an international full understanding of the necessity of mutual cooperation and support to low and middle income countries. And here, speed of action is very important. As it was mentioned, ACT Accelerator and COVAX are initiatives for global collaboration to accelerate development, production, and access to COVID tests, treatments, and vaccines. And the achievements of these organizations depend on the support and knowledge of the founders and sponsors. As it was mentioned, main sponsors are United States, EU, China, Japan, and separate West European countries. There are also private sponsors, for example, Bill and Melinda Gates Foundation. Personally, I am not so eager for establishing of new organizations. It's very important how we will help existing organizations and how we support them. Latvia is a member of European Union, and inside European Union had amendments to its 2021 budget to reach 1.2 billion for donation for COVAX. I think it was supported for all member countries. Inside European Union, member states have taken a common EU approach to secure supplies of vaccines. Safe and effective vaccines started to be distributed in the European Union by the end of 2020. Today, there is a sufficient number of COVID vaccines in Latvia, like as in other EU countries. And here I move to second my item, organization of healthcare system in national countries. Next, international cooperation. Ensuring a good healthcare organization in every national country is very important. The pandemic highlighted the shortcomings of healthcare systems worldwide. most health systems faced huge challenges fighting COVID-19, but countries with significant gaps in their health systems felt the impact of the virus more heavily. Often shortcomings are characterized by inadequate infrastructure, lack of trained healthcare workers, interruption of supplies of essential medical commodities, lack of data systems to monitor and track progress. The growing number of COVID-19 cases this autumn in Europe is a serious concern. However, the situation is different from one European country to another. While some set records for the number of cases, others have a high proportion of vaccinated population, and therefore it was possible to lift some of the restrictions. All we know is that safe and effective vaccines against COVID-19 are the best way out of pandemic. Vaccinating at this scale and in this time frame has never been done before. Vaccination organizers must be able to solve different types of problems. Appropriate placement of vaccination centers, organization of mobile vaccination centers in communities, necessity to ensure people's interest in specific types of vaccines, vaccination of older people in their places of residence. One part of society in Latvia, as in other countries, demands faster ensuring of safe health situation, while part of society doesn't support vaccination. Health system organizers face confusion, opposition to vaccines from different groups of society. Organizers face whole range of questions from citizens. Is it safe? How effective is the vaccine? Are there side effects of vaccines? People are waiting for an answer, and it must be given. In Latvia, the government is working to improve the vaccination process. In addition to the extended information campaign, certain forced mechanisms are also being created. For November 15, all employees of state administration and local government institutions and their capital companies will need a certificate of vaccination or COVID overload. Also from November 15, employees in the private sector who perform their duties on site and come into direct contact with customers will have to present a certificate of vaccination or overloading. Low rates of vaccine acceptance are a concern across the globe. Data released in January 2021 by the Johns Hopkins Center of Communication Programs suggests that across 23 countries, only 63% of respondents will accept a vaccine. That's well below the 75% recommended by health experts to make the further spread of COVID unlikely. As of National Health Service information from the 2nd of November, 61.8% of Latvian residents have received the first COVID-19 vaccine dose, while more than 54% have completed the vaccination process. And more than 70% persons older than 12 years in Latvia have received at least first COVID vaccine. And here we come to the third point I want to talk about, the dissemination of false information. Together with several health and economic challenges, the COVID-19 pandemic brought misinformation and confusion around the globe. Society is tired from COVID restrictions, from job losses, from the need to change the normal rhythm of life. Society has become intolerant. False information is often received in the tired public without proper assessment. Misinformation is something that we might expect for any major event that captures people's imagination. But in the case of COVID-19, the false information promotes dangerous health advice and might affect people's willingness to wear a mask, get a vaccine, or comply with other public health guidelines. Governments and local municipalities must care much more about the security and veracity of the information. They must play a key role in providing detailed, clear, and transparent official information that crowds out fake news. The websites of the responsible institutions in Latvia have a full range of information necessary for citizens and health professionals in 3 languages, Latvian, English, and Russian. Information on the vocational process and possibilities is continuously displayed in the media, but sometimes it seems not enough. Harder measures must be taken to limit fake news and cut the supply of false information. One of the important things governments can do is to encourage independent professional journalism and education for all groups of society. Technology companies also need to strengthen online accountability through stronger real name policies and enforcement against fake accounts. Dear colleagues, the future of our order has not been predetermined, but it seems that the development of our planet will depend to a large extent on our willingness to cooperate, to coordinate our actions, and to help each other. Good luck to all of us. Thank you.
Well, thank you, Madam President. And you raised again some very important points that relate to public information and disinformation. And I think no matter how good we are in distributing vaccines to all populations around the world, if people have the wrong information or incorrect information about the efficacy of the vaccines, then our efforts will not have amounted to much if people won't take the vaccine. So I commend you talking about public information and also how looking for ways to combat disinformation. And I also commend you that having a 54% vaccination rate for the people of Latvia is a very good accomplishment. Now our next speaker is going to speak in Russian. So if you would need the headphones for translation, I encourage you to take them now. But our next speaker, I'm very pleased to have on the panel because for many of you may not know, but I was U.S. Ambassador to Tajikistan from 2012 to 2015. So his country is right here in my heart. And I really feel a closeness to the people of Tajikistan. But we have as our next speaker, Imomali Nazruddinzoda, who's the assistant to President Rahmon on social development and public relations. It's a new position for him, so please, the floor is yours. Thank you.
Спасибо большое. Уважаемые друзья, позвольте прежде всего поблагодарить правительство Азербайджанской Республики и Международный центр имени Низами Ганджеви за предоставленную возможность принять участие и выступить на столь престижном 8-м глобальном Бакинском форуме, посвященном актуальным вопросам мировых проблем, вызванных коронавирусной инфекцией COVID-19. Уважаемые дамы и господа, всем известно, что коронавирусная инфекция COVID-19 негативно повлияла на систему образования по всему миру. Проблемы в этой сфере возникли на всех уровнях образования, начиная с дошкольного и кончая высшим и послевузовским образованием. Согласно доступной нам статистике, в первый год пандемии, в 2020 году в 124 странах образовательные учреждения были закрыты полностью. В 11 странах частично. В дальнейшем же 188 стран мира полностью закрыли свои учебные заведения, в результате которого более 1,5 миллиарда детей и молодежи остались вне образовательного процесса. Приведенные цифры показывают, что одной из сфер, которая больше всего пострадала от пандемии COVID-19, является образование. В связи с этим следует отметить, что сегодня у нас в Республике Таджикистан насчитывается 662 дошкольных учреждений, в которых воспитывается более 100 тысяч детей и работает почти 10 тысяч человек, и 1700 центров по развитию детей. Количество общеобразовательных учреждений составляет почти 4 тысячи, из них 300 учреждений начального образования, 400 основные общеобразовательные учреждения и более 3 тысяч средних общеобразовательных учреждений. Кроме того, в Республике Таджикистан действует 146 учреждений нового типа, 75 гимназий и 71 лицей. В целом в общеобразовательных учреждениях работает более 100 тысяч преподавателей и проходят обучение около 2 миллионов учеников. В связи с пандемией все эти учреждения, а также другие образовательные учреждения всех уровней на 2 месяца были закрыты. Из-за этого в последующий период в целом компенсации неосвоенной части учебных программ распоряжением лидера нации президента Республики Таджикистан уважаемого Эмомали Рахмона учеба была организована в период летних и осенних каникул. Пандемия одинаково негативно повлияла почти на все страны мира, в том числе и на нашу страну. По данным ООН, она прежде всего существенно повлияла на семьи с низким доходом. В связи с этим, согласно распоряжению президента Республики Таджикистан, в нашей стране кредитными организациями были предоставлены населению льготы по кредиту. А для улучшения социальных условий населения с 1 сентября 2020 года пенсии, заработная плата работников бюджетных организаций и учреждений, а также стипендии была увеличена на 15%. Пенсии группы инвалидов, нуждающиеся уходом, на 50%. В целом в Таджикистане были предприняты меры для обеспечения социальной и экономической стабильности. Но несмотря на это, данная проблема, которая имеет общемировое значение, должна быть решена совместными усилиями всего мирового сообщества с включением в данный процесс ООН и его специализированные учреждения, такие как ЮНЕСКО и ЮНИСЕФ и другие. В целом пандемия показала, что во всех странах мира наиболее распространенными оказались следующие проблемы в общеобразовательных учреждениях. Первое. Трудности в организации полноценного дистанционного обучения. Второе. Недостаточная техническая подготовленность учителей и организаторов учебного процесса. Третье. Сложности с техническим обеспечением учащихся как у самих образовательных учреждений, так и у семей. Четвертое. Недоступность учебных материалов в условиях дистанционного обучения и так далее других. Правительство Республики Таджикистан и Министерство образования и науки нашей страны совместно со школами работают над решением этих проблем. В этом направлении созданы электронные копии всех учебников с 1 по 11 класс среднеобразовательных учреждений. Другая проблема, которая возникла в сфере образования под влиянием распространения коронавирусной инфекции COVID-19, во многих странах мира касался дошкольного образования. Здесь наряду с педагогическими проблемами возникли некоторые трудности социально-экономического характера, так как некоторым родителям в связи с закрытием детских учреждений пришлось отказаться от работы, что в свою очередь привело к ухудшению экономического положения многих семей. В нашей стране, хотя эта проблема не является столь существенной, но все-таки имелись определенные трудности и в этом направлении. С другой стороны, к решению этих проблем наряду с государством вовремя подключилось гражданское общество. Говоря об экстремальных формах организации учебного процесса и период чрезвычайных ситуаций, в том числе при пандемии, придется признать, что несмотря ни на какие факторы, решать проблемы общеобразовательного уровня только посредством организации дистанционного обучения не полностью отвечает требованиям учащихся этого уровня, в особенности запросам учеников начальных классов. Здесь имеет своя специфика, так как ребенок, обучающийся в начальных классах, обязательно нуждается во взаимодействии с педагогами и учителями. С другой стороны, ученики начальных классов еще не способны к самостоятельному изучению, а тем более к самостоятельному освоению учебного материала. По этой причине на данном уровне образования обучение детей должно включать разные элементы, она должна стать синтезом различных форм и методик преподавания. Трудности, которые возникают вследствие пандемии в сфере образования, правительство республики и все образовательные учреждения нашей страны усиленно работают в направлении поиска возможностей путей решения вопросов с учетом извлечения уроков во время пандемии. Во-первых, это решение вопроса с доступом к интернет-ресурсам в силу того, что 93% территории Таджикистана занимают горы и почти 70% сельской местности. В связи с этим Министерство образования и науки при поддержке правительства страны разработало план действий по финансированию внедрения современных информационных технологий в отдаленных горных местностях. Во-вторых, для решения данной проблемы решено повысить уровень цифровой грамотности населения и обучать все субъекты системы образования в республике современным информационным технологиям. Помимо того, для обеспечения информационной безопасности уделяет больше внимания вопросам правового образования с учетом его огромной роли в повышении уровня совершенства правовой культуры и правового просвещения в целом. Что касается проблемы вакцинации населения, то следует отметить, что в Республике Таджикистан она идет согласно намеченным правительством планам и находится под пристальным контролем Министерства здравоохранения и социальной защиты населения республики. В нашей стране педагогический и обслуживающий персонал образовательных учреждений в числе первых наряду с медицинскими работниками почти полностью прошли процедуру вакцинации. Что касается обучающихся вопросам о вакцинации, которые все еще не решена в мировом масштабе, то и здесь при принятии окончательного согласованного решения Республика Таджикистан готова принять все необходимые и зависящие от нее меры в данном направлении. Еще раз выражаю свою признательность правительству Азербайджанской республики, особенно президенту Республики Азербайджана, Международному центру имени Низами Ганджави и всем другим организаторам за предоставленную возможность принять участие в 8-м глобальном Бакинском форуме. Благодарю за внимание. Спасибо.
Well, thank you, Mr. Nazruddin Zoda. I think that you have raised, and it's a good end to our panel because we're just about out of time, but you've raised the very serious issue of what the pandemic has done to the educational system. And I think the problems that you've just outlined that Tajikistan faces are not unique to Tajikistan. Even in well-developed countries like my own, in the United States, access to the internet and ensuring that students have the ability to be taught when the schools are closed, I think is extremely important. And I think that this past year and a half of students not having proper access to education is something that needs to be incorporated in the discussions that we will have about vaccine distribution and about the long-term effects of the COVID-19 pandemic. So I think that we've seen the isolation can lead to mental health issues, not only getting behind in education, but also in higher suicide rates. So something that I think needs to be considered. So as we close the panel, because I think we're going to just about close on time, which was what I was hoping for in our panel, is to sum up, and if any panelist has anything they would like to add. But I think for me, the important takeaways that we have from this panel are not only that we need, as the global community, to ensure that everyone has equal access to vaccines, equal access to healthcare, but also to address the related problems to the pandemic, the dissemination of misinformation, which is an extremely important problem that we need to deal with, not only for vaccines, but in many other areas. The effects on education, and how do we help students who have been unable to go to school over the past year and a half? How do we help them to catch up? Sharing of information, transparency. So how do we look for ways that we have better public education and allow for people to be able to know that when they get a vaccine, when they make the decision to receive the vaccine, that it's that they're doing it with proper information. And I would also lastly say that I think forums like this are extremely important for us to be able to look at all the aspects of what a pandemic can do to our global society, and the importance of not only regional multilateral cooperation, but global cooperation through organizations like the UN and the Nizavi Ganjavi International Center. So I want to thank all the panelists for sharing their ideas, because again, you've all brought up interesting points of view that that I hadn't planned on discussing, and especially thank you for bringing up education, because I think that's an extremely important issue that we have to deal with when we look for how do we cope with future pandemics. So thank you again, and we've stopped just in time for lunch. So thank you. Yeah, we're fortunate.